Okay. Here we go. Good morning, all, and welcome to another SADA webinar aimed at educating members of the public and empowering you with knowledge. Today, we have the pleasure of hosting Ms. Emma King, who will be enlightening us on the various factors to consider when selecting your teeth whitening product of choice. Emma is an independent oral hygienist with expanded functions, as well as an international speaker and teeth whitening and aesthetic professional with almost 8,500 bleaching cases to her name. Welcome, Emma, and thank you for joining us today. Over to you.
Thanks very, very much. Yeah, so I think it's one of these lectures and that you just never really present to actually the end users. And it's always to your fellow colleagues about how to use products and how to get the best results. But it's really great to be given an opportunity to actually speak to people who are considering actually having teeth whitening done themselves. So it's nice to know that there are so many different factors that they actually need to look at, and just trying to help people and explain to people what they should be looking out for when it comes to their teeth, their support structures, and getting the best results for their whitening with the safest results so they don't have any damage whatsoever. And in 2009, it actually became illegal for anyone other than a dentist or an oral hygienist to whiten your teeth. These are your dental professionals. So when you have any questions with regards to your actual teeth, your gums, anything to do with your mouth, you really want to make an appointment with your dentist or your oral hygienist and get their professional opinion. So there are so many little salons and spas popping up all over the show. And I think like anything in life, when it comes to buying cheap, you end up getting cheap. And that's when you cause damage. You know, you have one set of teeth, and you really need to look after those. So basically, there are a lot of things with regards to you want to try and use products that are tried and tested. So always look for the professional brands. They actually spend millions and millions on all their clinical tests and trials. And that is what we're trying to clamp down on, to take bleaching really to the next level as far as the professional side is concerned, but to ensure that you as the end user don't have damage to your teeth and get really good results. And you want to do a little bit of research with regards to the products that you use. I personally use the Philips Zoom products. They have been tested and tried, backed by a massive company, used internationally, and only sold to dentists and hygienists. And those are also things to consider, not products that are brought into the country and are not actually registered and are used by anyone. So those are important things to do. With regards to your options, every single bleaching case that you do should actually be customized. So think about it like weight loss. If you are someone that's 70 years old and you have never whitened your teeth before, but you're suddenly deciding to do that now because you want to have a little smile makeover, it is probably the easiest and the most reasonable way of getting your smile makeover without having to drill and fill your teeth. So it's less damage. It's a fantastic way of just taking 10 years off your smile. But again, you want to make sure you do it safely. If you're 70 and those stains have been there your whole life, it's going to be the equivalent of like a 60-kilogram weight loss. And it's the easiest way to really explain it to people. So someone is in their 20s and their 30s and they're wanting to have a little boost. It's like a 5 or 10 kilo weight loss. So it's not going to take as long to get your end result. And that's also something that needs to be considered. So you cannot go and have a one size fits all with anything in life. And the treatment on your teeth is no different. You go and have fillings, and you don't just have a drawer full of little square or round or triangular fillings and they just pop those in. Everything gets customized to suit you. So it's also important to make sure that you know the difference between having your teeth professionally whitened. Actually, terminology correct is actually bleaching in the chair with your dentist or your hygienist, as opposed to simply whitening. So whitening is really just removing surface stains and enhancing the natural color of the teeth. And that you can do with any toothpaste or mouthwash, but it is not going to actually change the color of your teeth. And that's very important to understand. So if you think about it, your toothpaste are generally over the counter when it comes to your whitening brands are going to be acidic and they're going to be abrasive. So in the end, extended use of these products does exactly the opposite of what you want them to do. It wears down your enamel. It makes your teeth even more sensitive. It exposes the areas underneath the enamel, which is where most of the staining is held. So that's in the dentine. And the teeth actually become more brittle. They become softer. They become more sensitive, easier to get decay, and they become darker. So they do exactly what you don't want to happen. So when it comes to your bleaching products, all of them are acids. So for them to be stable, they need to be kept as an acid. But that is also why I believe in using these products that are all dual barreled. And when they get applied onto the tooth, they get applied as an alkaline ingredient. So there is no damage done to your teeth whatsoever. And it's only really when you have extended use of products. So there is such a thing as over bleaching. And once you've got your end result, that's why it's important to work with a dentist or a hygienist who can tell you, okay, enough now. This is as white as your teeth are going to go. Now you can stop bleaching and you need to go onto your maintenance. So these things are very important so that you don't overdo it. Overdoing anything in life is never beneficial. Okay, so customization can come in various forms. Maybe your budget only allows for 3,000 Rand worth of teeth whitening. Maybe it allows for 7,000 Rand. So depending on what you're paying, you're also going to get different options given to you. So the more that is done in the chair, the faster your results are going to take, but also the more expensive it's going to be. So you've got options for take home as well as in-chair whitening. And take home whitening just takes you longer. It's as simple as that. You can do overnight bleaching. You can do take home bleaching that takes you only 30 minutes a day. So one of the biggest things that people don't understand is they give you the weakest gel that is generally for overnight bleaching. It's often the most sensitive. So it's that constant wear time. So even though the gel is a weaker gel, you get beautiful results from it. But those I would tend to give to someone that doesn't have a lot of sensitivity. And that's another issue that people are always worried about. So bleaching doesn't really cause sensitivity. It basically will just highlight or stimulate the nerve a little bit during the bleaching process, and it's nothing that doesn't disappear within the 24 hours. So when I was explaining the difference between the bleaching and the whitening earlier, bleaching is really using a hydrogen or a carbamide peroxide gel that is going to be applied onto the tooth, and it needs a minimum of 5 to 15 minutes worth of contact time, which again, your toothpaste and your mouthwash can't do. Most of us know that even though we tell you to brush for 2 minutes, it's more like 30 seconds to a minute. So there's no ways you're going to get a change in color in that time. And if we were going to equip you with gel that was strong enough to actually bleach your teeth, you would find that it would cause significant damage to actually your gums and your support structures, which is not something we want to happen. So with regards to your take-home whitening, we also advise the professional use of customized trays, so it only fits your mouth. That way you have a lot less chance of obviously getting the gel onto the gums and causing a lot of problems with your support structures. It doesn't help having these beautiful white teeth and you've got no gums to keep them in place. So it's very important to make sure that all of that is controlled and that you have all the right instructions. And that is not something you can do when you're buying something over the counter and it's a one size fits all. So that is essential. Budget, as I said, is something that you need to look at, but also know your brand. So say you decide that you want to have a Philips Zoom in-chair whitening and you want to follow it up with some take-home whitening. You must make sure that the brand that you've been given, including the gel that's going in your mouth or take home, actually says Zoom on it or Philips Zoom. If you're using other products, exactly the same thing. So look out for branding, look out for that because it makes a massive difference to the results that you're going to get and the damage that could happen to your teeth in the long run. So again, advise, always seek your professional when it comes to those sort of things. Why would you customize it? And sensitivity could be a big reason to customize your bleaching options. So the longer, the slower, the more gradual the process, the more sensitive, as I explained earlier, it could be. So if you've started off with sensitive teeth, you actually want to do short little sessions in the chair or short sessions at home. And the wear time is important, no more than 15 minutes or 30 minutes, and that'll help you control your sensitivity. You can also chat to your dentist or your hygienist, and they can cover all the areas where there's wear and tear on your teeth. They can limit the amount of bleaching done in one day, and they can customize that take-home option just for you. So that's also essential. But it is not that your bleaching itself is causing the sensitivity unless you are doing it in the wrong hands. So that is also very important to remember. When people are not equipped and they are not trained and they're not qualified to work in your mouth, you have a bigger chance of having massive problems done. And a lot of those are irreparable damage. So I know sometimes you want to get away with spending 899 Rand or 1,000 Rand as opposed to spending a few thousand, but rather save up. Rather go to your dentist and ask them if there's payment plans. It's a much safer option and it's a much better option, and you're going to get better, longer lasting results in the long run. So you also don't have to go and change your diet indefinitely. Most of the time, it's just the first 24 hours after any in-chair bleaching is done that you basically need to avoid any colors that could stain a white top. So it's very simple. You would avoid coffees and teas and red wines and curries. Obviously, if you're a big smoker, you can obviously try your best to avoid that. Otherwise, you put your little bleaching trays in and you smoke through that. I know it sounds ridiculous, but I promise you it helps and it saves your results. I don't think anyone just wants to have teeth whitening done for one specific date and then they don't worry about what the color of their teeth look like after that, even if it is your wedding day. Don't leave it till the last minute. Give it enough time to make sure that you plan it properly and you're not running around trying to bleach your teeth the week leading up to the wedding and you have possible side effects with sensitivity. That's the last thing you want to be doing. So also when it comes to combining your bleaching with regards to any dental work, it's amazing the difference it makes by just whitening and bleaching those teeth first before you do any other dental work. It limits the amount of dental work that needs to be done. And all of us spend our time in dentistry and in the profession trying to make sure that we do as little drilling as possible and save as much of the enamel as possible. So I think most practices should be offering bleaching. If they're not, you ask your highness offering a practice that is. And then to go and get started with your bleaching before you do any other kind of dental work. So if you're wanting to straighten your teeth, it's a good time to start with the whitening. Then you wait a month or so before all the scans are finished and done. And by the time you start your aligner journey or your clear aligner braces, that's when you can then maintain your smile from there. And you can actually look after your beautiful white teeth indefinitely for many, many years. I have a lot of patients who maybe just once or twice a month put the little customized bleaching trays in at home on their own. Otherwise, every second time they come in to see me for a cleaning, so maybe instead of every 6 months, maybe every second appointment, so once a year, they would have just 1 or 2 15 minutes in the chair using an LED light, which helps to obviously accelerate the actual process. So there are reasons that we choose different options to offer our patients their best results. The in-chair options can be just the gel on its own, or they can be accelerated with an LED light. So we want just enough energy to be able to increase the speed at which the process takes place, but you don't want to have too much heat, say from a UV light, to actually create the warmth that creates the heat and heat the actual gel up, and it heats the nerve. And then you're going to have problems with your sensitivity. So all bleaching options should include take-home trays. You want to be able to maintain it, and it's the easiest way to do it. It takes you so much longer just to get into your car and drive to your dentist or your hygienist for a touch-up than it would do just to put the trays in for 30 minutes. And that makes a massive difference. I think people, when they do have their weddings, try and look at doing it at least 6 weeks before the time. So your results are perfect long time before, rather than still worrying about running around, as I said, the week before the wedding. And with regards to the timing, those things are essential. So you also, when you're coming to having dentistry done, anything that you're going to be bonding afterwards, you need to wait about 2 weeks before you can go back and see your dentist once you've got your beautiful results. So you can't fly in from somewhere and expect to have everything done from Monday to Friday, including getting your best results for your whitening. It's impossible. You end up with a lot of oxygen in your teeth, and it decreases the ability for those fillings to be able to bond onto your tooth. And so that's not actually helping you in the long run. You want to do things properly. And as I said, so you always start with your actual bleaching process itself. The professional products, as mentioned, are clinically trialed and tested. So those are the brands that you want to look for. And there's so many things and factors that need to be thought about. You've got to be realistic as well when it comes to the color that you're expecting your teeth to go. And you can't whiten anything that isn't an actual natural tooth. So if you've got dentures, if you've got veneers, if you've got crowns or implants, which have got crowns over the top of the implants, none of those will actually whiten. So you need to consider to do the bleaching first, get your color stable, and then have all of that done and finished, so that you have this beautifully paired result where all the new crowns and veneers or a denture that might just be 1 or 2 teeth actually blend in and match the color of your new teeth. So those are essential things to think about when it comes to planning your whitening. The expectations with regards to your color is also enormously important. So I have a lot of patients coming to see me, and they really expect to have these glow in the dark white teeth. Not only does it look terribly unnatural, a lot of people want to have their teeth so straight and so white that they look so different to what they currently have. And it's so obvious that it's just not their own tooth structure. So you want to whiten so that you get rid of the yellowing effect. You want to get rid of all the old stains that have gradually built up over the years, but you also want to make it look natural. And you can't sign on the dotted line. Having done over 9,000 bleaching cases now, I still can't guarantee an exact shade and color for any patient for when we finish our bleaching. So we really stop once the teeth stop moving color. And some cases are as simple as in a week, we end up with our perfect result, and others take us 3 months to get our perfect results. So the more stubborn the stains, the darker the color. If you've got spots on them that are black or brown, and we're trying to actually bleach all of those out, they could take up to 3 months to get rid of. And in combination with your take-home whitening, it's an essential part of maintaining your bleaching and keeping it looking good for many, many years to come. So your diet is an important role as well, plays an important role, as do all your habits at home. If you're going to keep smoking and you're going to keep drinking 10 cups of coffee a day, then your maintenance with your whitening program also needs to be slightly upped in comparison to someone who doesn't have any coffees or teas, doesn't smoke or have any curries. So all of that is also going to be customized. So you'll probably only work out 6 months down the line how your actual maintenance program is working for you. If you feel the teeth are looking amazing, then you stay to exactly what you've been doing. But if you feel that they've lagged back in color a little bit, perhaps buy a few more bleaching syringes and maybe have a little session in the chair and then change your maintenance program from there. So that's really, really important. There are a lot of professional whitening toothpaste brands that are out there. And again, as much as they aren't going to change the color of your teeth, they're an amazing product or are amazing products to use to help maintain the color. So because they're professional, they also make sure that they don't damage your teeth. So you're not going to have the abrasiveness. and the high acidity value that most of the over-counter whitening toothpaste do have. So they really, when paired, they really do work properly. When you're doing your little maintenance at home, most of the time you've actually got to stick to using a white toothpaste and a clear mouthwash. And there are a lot of professional brands out there that actually offer that. Listerine even has some beautiful alcohol-free brands. They have some whitening, clear mouthwashes that you can use. There are quite a few out there. We have an O7 one, which is an oxygen therapy clear brand, which will actually also help to maintain your oral health, which also helps. So keeping an eye on how good you are brushing and flossing makes a massive difference to actually keeping those teeth nice and white too. So the cleaner the tooth surface and the better you're managing to brush and floss and get rid of all the debris and all the bacteria on the tooth surface itself, you'll find that the less chance you have of having stains being attached to the actual tooth surface. So you will also manage to maintain that whiteness for a lot longer. And that's really important. So regular cleanings, investing in good toothbrushes. You can choose maybe a Philips Sonicare toothbrush. There are a lot of sonic brushes out there. Philips Sonicare has been out for a very long time. It helps to push little water bubbles between the teeth. It helps to clean into the gum margins as well as keeping the teeth healthy and removing the bacteria for you. So you still got to brush the teeth as well. So it's an extra aid, and it really does work better than a manual toothbrush. And maybe investing in a water pick, so something that would actually irrigate between the teeth, because we all know that as much as we want to admit, or we don't want to admit to our dentists and hygienists, that we floss every single day, and then when questioned, maybe once a week, and then maybe actually once a month, and then maybe the last time you actually had your teeth flossed was when you were actually in the dental chair. So these sort of things help. You can even put a little bit of peroxide in the water pick, which helps to irrigate between the teeth, stimulate the gums, and get rid of a lot of bacteria. And in many cases, far more effective than actually using the string floss on its own. So all of these things to aid to prevent the bacterial buildup and the stains collecting against the tooth surface itself. Your diet in the long run, as well, as I said, you really don't have to change it. You hear patients asking all the time, but I've whitened my teeth now I'm never going to be able to have coffee, and I'm never going to be able to have a cigarette again. Look, we don't advise smoking anyway, so but we draw the line with where our responsibilities end. We can only advise so much, but it really is just those first 24 hours and for an hour after home bleaching. And after that, once you've achieved your best results, you really do go back to your original diet and just do your maintenance. So when it comes to bleaching, when it comes to improving your smile, the most important thing, as I've mentioned, is trying to always approach your dentist and your hygienist to get their professional opinion. Don't Google, don't go and try and seek the advice of your beauty therapist or anyone else who might have a little clinic at home. Remember, they are not allowed to work in your mouth, and more than likely, those products have never been tested or trialed on anyone. So my advice for whitening is, as mentioned, seek the help of your professional. Always look after your oral health. Oral health comes first, and you always have to get rid of any disease before you start to whiten. So that's another important reason to approach your dentist and your hygienist before you go ahead with any whitening program. If you have cavities, if you have gum disease, if you have any issues there whatsoever, you are already compromised. And now you're going to add an uncustomized, or basically a package that hasn't been customized for you. Nobody's checked any of that out. All of that is going to be 10 times worse if left untreated. You can lose significant gum, support structure. You'll cause a huge amount of pain when it comes to cavities and areas that haven't been sorted. So that is essential that your oral health is taken care of before anything else, and only your hygienist and your dentist can make sure of that. So always bleach first before you continue with any other dental treatment. you will be so surprised by how basically the amount of dental work that needs to be done afterwards in comparison to when you hadn't even considered whitening. Now you'll find that every single tooth might have been veneered or crowned, and you will find that you have a lot less drilling, a lot more tooth structure, and you'll find that you've got teeth that are going to last you a lifetime. So look after your oral health. You have one set of teeth, and you make sure you take care of it. And if anyone has any questions with regards to options or anything they'd like to know about what they should do when it comes to whitening your teeth safely and getting the best results without any damage, you can email me anytime on info@zoomwhitening.co.za, or you can WhatsApp me on 082 823 7435.
Awesome. Thank you so much, Emma. I'm sure that that was really informative for the public out there, especially those that may be contemplating going to a beauty therapist or a beauty salon for whitening because they've seen this amazing special that has popped up online. I think it's so important that we just advocate that the
Absolutely.
professionals who have experience in this and have the necessary training are the most qualified people to deliver the service. But yet again, thank you for making yourself available, and have a lovely day further.
Thank you very much. You too.
Thank you so much. Bye, everyone.
Bye.
Bye.